the government to reform organ transplant policy, talking about the federal government. The federal government said that the new policy guidelines on organ donations and transplantation in the country will be out before the end of December. This came as the government decried recent unprecedented cases of irregularities and criminal exploitation in the sphere of organ donation and transplantation in the country, blaming the development on ignorance on the part of the victims and the sheer moral bankruptcy of members of the syndicates involved. The government's determination to immediately release new policy guidelines followed the validation of the draft guidelines by critical stakeholders during a one-day stakeholders workshop meeting on organ donation and transplantation guidelines in Nigeria held in Abuja yesterday. The guidelines were developed by the National Tertiary Health Institution Standards Committee, NITISC, which was tasked with the responsibility following its establishment under the National Health Act 2014 set and to set and uphold minimum standards for the tertiary health facilities across the country, as well as to oversee and accredit the regulation of organ transplantation facilities. The document, which was reviewed and validated by the stakeholders, encompassed critical areas such as ethics, kidney transplantation, liver transplantation, eye tissue transplantation, bone marrow transplantation, and a chapter that addressed gamete and embryo donation, storage, and surrogacy. Director of Hospital Services and Secretary in National Tertiary Health Institution Standard Committee, Dr. Jimal Salawuddin, told newsmen on sideline of the event that the new guideline will be out at most by next month, December. Earlier in her remarks, the Permanent Secretary, Federal Ministry of Health and Social Welfare, Ms. Kacholom Daju, who was represented by Dr. Jimal Salawuddin, expressed concerns, saying in recent times, we have witnessed troubling incidents of alleged unwholesome practices involving organ harvesting. The guideline has already got its drafts. The gathering is to validate it, bringing together all the experts to look at it again for the second time, after which the minister signs and forward to Mr. President and he approves it. It becomes the policy, he says. It may be difficult to ascertain when this incident started in the country, but the reality is here with us, and it is imperative that we address these challenges head on. She said, I would like to recommend that the NTHISC and the panel that worked tirelessly to produce these comprehensive drafts. Their commitments and expertise and collaboration spirit have been instrumental in developing guidelines that will not only address current challenges but also set a standard for ethical practice, conduct in organ donation and transplantation. I would love to get your thoughts on this, sir.
Okay, it's an interesting area wherein I did a lot of deep search therein when the issue of Ekweremadu shot to limelight, whereof he was convicted in the UK. It's unfortunate. You see, there's a way the law works. Now, I'll use this practical example to drive home the point. It is not as if federal government does not know that Nigeria has what it takes to refine her crude oil locally for the benefit of all Nigerians. It's not as if government does not know. They know. But because of greedy gain by few criminal minds within the corridor of power, they will prefer this economic holocaust to continue. Now let's zero to what is going on. You know that under the 7th National Assembly, when Ekweremadu was the deputy Senate president, that was when the National Health Act came into effect. And that National Health Act was sponsored by outsiders, enemies of this country.
Are there proofs to this claim?
Yes. when we finish, go and Google. I will send it to you so that you can share it on the subsequent program with because definitely callers may call you. So I'm saying it, they can contact you. I will supply you the detail. Go and check Dr. Njemanze on the National Health Act. I have made pronouncement on that young man. I don't know him from birth, but I say whatever womb that gave birth to him, God should bless the mother and the father for his boldness and tenacity and the position he took. You know, the National Health Act effectively signed off our organs. As we are sitting on this table, our organs are already signed off. Our organs, if we enter into a health facility, the chief medical director can determine if our organ can be harvested. Njemanze argued that for the first time that there's this thing they call a Helsinki Declaration, which is a binding this thing within the medical field. If I am to donate my organ, my consent must be obtained. If I'm so weak, my next of kin, you know, there are people who are to be hauled in for medical emergency, and then they will ask somebody, either the husband, to sign. The issue of consent was removed from our law under the current National Health Act. And one danger that our leaders are blind, you know, people are blind again.
I want you to rephrase that when you said our leaders are blind.
Majority of our leaders are blind.
Over what,
yes.
Please?
Blind to the extent that if they are driven by gain, inordinate greedy gain, they do not consider the consequences.
I would love to call you to order.
Okay.
Yes, I would love you to try as much as possible not to use vowel words. It's okay to express how you feel.
Yes, I'm being very careful.
Yes, it's okay to express how you feel. So I would love you to rephrase and maybe take your words accordingly and not use vowel words.
Okay, now, fine. I give you an example like this Ekweremadu case.
Okay.
If what Ekweremadu did went to Nigerian courts, Ekweremadu was a free man. Take out time and listen to the judgment that sent him to jail. The medical doctor that was used, he had lost it all. His medical license has been revoked. So he's useless, practically speaking, in terms of being able to practice no more. The whole thing, when you listen to the judge and the reasons he gave, you will now understand the working and the mindset of most of our leaders. Now, I am sure that they are now victims of the state of the law. Are you listening? Now, this committee that came up now,
okay,
they have seen the dangerous effect of this removal of consent and some other aspects that are still present in most of the international law practice. In Nigerian case, it's a different thing altogether. I hope they will amend the main law and then take into consideration that people who are living here are human beings. Because from what that report is saying, there's a spike in illegal organ harvesting.
But that's not what it states. It's not exactly.
That's what they are trying to cope. Do you understand? They want to regulate. When you talk about this regulation, they want to strengthen the position of the law, just as I said in the other case when we were commencing on this program. When the law is strengthened, when the law is there, and everybody is equal to the everybody can be taken down by the law, people regulate themselves. Okay. Do you understand it?
Yes, sir.
So I do hope that this regulation that they are trying to bring up to check this illegal organ harvesting, I do hope that they will take quick step on it and amend the main law. Do you understand?
Yes, sir.
Which was powered by Govt then, and some other international interest group, okay, that passed the National Health Act. I hope they will be able to touch those relevant sections and amend them to save the life of Nigerians. Okay. That will be good for us.
Thank you for your thoughts on that.